Well, a fast-spreading strain of the coronavirus, first discovered in South Africa, has been detected in at least 60 countries worldwide and 21 African countries. The variant appears to make some COVID vaccines less effective and has raised concerns that people who already had the disease could get it again from the new strain. Well, joining me now to discuss this is Senior Health Advisor, Lagos Health Summit, Dr. Azeezat Yishawu. Thank you very much for joining us at this point.
Thank you so much for having me.
All right, so this strain of COVID-19, the South African variant, has affected several countries, at least 27 African countries. What are we doing? What have we put in place? What are the modalities we have put in place as a nation to ensure this strain doesn't come? Because I hear it's deadlier than the current strain we have.
Yes, thank you very much. I think that if there's anything that I would like to comment what we've been doing so far is that we've not actually, in Nigeria or particularly Lagos State, has not reduced its effort in trying to prevent the disease. All the activities, all the measures that have been put in place to ensure the spread of the disease as well. And now that we've been informed by WHO that the South African variant, which is actually very virulent, is spreading across African countries. Bearing in mind that Nigeria, the vaccination for Nigeria, we got the AstraZeneca vaccine, and the AstraZeneca vaccine is not yet known to have a high amount effect on this particular strain. So it's only normal that the government, all government parastatals, also beef up the other non-pharmaceutical measures that have been put in place, travel bans from countries that have high infection rate from this particular variant, ensuring that the compulsory test, COVID-19 test, is what is ensured for people that are coming into the country, and also to ensure that there is quality and there's integrity in the process, because we had issues some times ago about people through unscrupulous means giving certificates of non-infective giving certificates to people who actually did not carry out any of the COVID-19 tests, so that when they travel or people while coming into the country. So the government has to fix on those areas as well to make sure that there's integrity and there is truthfulness in the process that in the test process in Nigeria as well.
All right, so when a lot of people were talking about the B1351 variant of the COVID, I asked one question: how did it spread this far? But from what you have just said now, and of course the nature of our borders, especially the coming to Nigeria via our airports, is this a concern for you that this might come into Nigeria?
Yes, definitely. This is a major concern to us, because definitely some of the neighboring countries, such as Togo, such as Ghana, we have Niger, some of Chad. These people, this country really have statistics on the number of people that they've successfully vaccinated, and Nigeria is yet to even our vaccination is at 0.89%. We're yet to even achieve a single-digit vaccination for our population compared to other countries like Israel that are already at 60%. And like I said, our borders are very, very porous. We have little amount of security in some of the land borders that we have, particularly the land borders that we have. And so if this virus, South African virus, is already spreading to neighboring African countries, then people can just walk in. People with the viruses can just walk in without any form of filtering or any form of testing that they could go on to assess whether or not. So and the border issue is not something that we could immediately, it's not a problem that we could immediately sort out. So we have to think about other means that would also assist us in preventing the spread of the vaccine, the virus rather, in Nigeria. So one of those means of is to ensure that a good percentage of Nigerians are vaccinated. Are we trying to seek out more vaccination from international bodies? We really have about 4 million, approximately 4 million vaccines. That is not enough to vaccinate adequately Nigerians.
But do we have enough vaccines? The AstraZeneca vaccine is seen as the only one that can fight this strain. And of course, a lot of countries too who have this strain will want to get this vaccine. Do we even have enough, and can we get enough?
Yes, that's the problem. Currently, the WHO is working to buy the patent rights from these companies such as Moderna, Pfizer, AstraZeneca, so that they can release the the formula or the rights towards this particular vaccine, so that countries as well who have the capability can start picking up or providing the vaccines themselves. The vaccines are not enough, and because they come from individual or private pharmaceutical companies, they also have to think about their host countries providing enough vaccines for their host country. They also think about the financial and economic implication to the company as to the company as well. So I think recently there are talks with WHO as well and other health organizations to buy the patent rights. So that means these institutions will be able to release publicly the formulas for what they are on, share publicly they are. And so these are one of the ways I think that also we can improve. If not, we just have to beef up non-pharmaceutical measures as much as we can.
All right, Senior Health Advisor, Lagos Health Summit, Dr. Azeezat Yishawu, thank you so much for talking to us.
Thank you so much for having me.